Okay, if you've started searching for an eyelid surgeon, you've probably been told to find a board-certified plastic surgeon. Now, while that's not bad advice, it's not the whole answer. There's a whole other specialty that exists that most people have never heard of that does eyelid surgery exclusively, and the difference between the two changes how your face gets approached on the operating table. I'm Dr. Kian Aftakari. I'm an oculofacial plastic surgeon, which is the specialty most people have never heard of, and I've been practicing for over 10 years. And if you're getting eyelid surgery, this is the specialty that does it at the highest rate within their own practice. Let me show you why. The first reason most patients have never heard of this specialty is that the name is a mouthful. Oculofacial plastic surgeon, sometimes called oculoplastic surgeon, sometimes called ophthalmic, plastic, and reconstructive surgeon. All three are the same thing. The mouthful name is part of the reason this specialty stays invisible to most patients. When you're searching for a surgeon at midnight, plastic surgeon comes up first because it's the easier word. But that easier word is hiding something important, and I want you to just understand the difference between the two. A plastic surgeon and an oculofacial plastic surgeon take completely different paths to operating on the eyelids. A plastic surgeon goes through general surgery, think the whole body, and then does a residency in plastic surgery where they learn body surgery, face surgery, eyelid surgery, all kinds of amazing things. They're trained across the entire body: face, breast, hands, body contouring, reconstruction after trauma, and eyelid surgery is one of the many things that they learn along the way. An oculofacial plastic surgeon takes a different road entirely. We start in ophthalmology, the medical specialty of the eye itself. That's 4 years of residency learning how the eye actually works, moves, focuses, and heals. We study what diseases can affect it and what can go wrong with the eye, from the front, the cornea, to the back, the retina and the optic nerve. After those 4 years, we then do a 2-year fellowship in surgery of the eyelids and the structures around the eye. So while both specialties can take 6 years to get training, oculoplastic surgeons spend 5 of those 6 working just around the eye area. Now, at first, this might sound like kind of a minor distinction, but I promise you it really isn't. Here's the way I think about it. As a plastic surgeon, you learn everything in the body in terms of skin, soft tissue, and reconstruction, and the eye is part of that. As an oculofacial plastic surgeon, the primary training is in the eye itself. It starts there. So they're thinking about the eyelid not just as skin and soft tissue, how it behaves, how it blinks, how it protects the eye, and how it fits into the larger picture of your face. It's just a different emphasis. Listen, the eyelids exist for a reason. They protect the most sensitive organ in your face, opening and closing thousands of times a day just to keep the eye lubricated. They drain your tears. They have to close completely when you sleep or the surface of your eye dries out and gets damaged. When you're trained in the eye first, those functions are what you see when you look at an eyelid. When you're trained in skin and soft tissues first, the function comes second after the appearance. Both surgeons are talented. Both went through years of training, but they're solving slightly different problems when they pick up that scalpel. The whole specialty of oculofacial plastic surgery started because of one key insight during the war. Back in the 1940s, after World War II, where there were so many gruesome facial injuries, surgeons back then realized that they needed more specialization on how to reconstruct the faces of injured soldiers to focus on how to protect the eye, but still be able to open and close the eye. That's how my specialty was born. Now, I want to be honest, both specialties can produce incredible results, but there are situations where the training really starts to matter, and these situations are more common than people realize. Ptosis repair, which is when the upper eyelid is drooping because of a muscle problem, that's one thing. If you get this wrong, the eye can become way too open, and sometimes it can be hard to close. That's a situation that nobody wants. Revisional surgery, when a previous eyelid procedure didn't go well and the eyelid isn't closing properly anymore, that's a complication for the eye. It's not just a cosmetic touch-up. These are real reasons people end up needing to see me or another eyelid specialist because they weren't getting enough protection of the eye after a previous surgery. If this is helping you make sense of who actually does what, hit the like button. It helps the channel reach other people who are trying to figure out the exact same thing. And if you're thinking about eyelid surgery yourself, you can book a consult with me at eyelid.pro/book, or you can find a local surgeon at oculofacialsociety.org. If you want to verify that the surgeon you're considering is actually an oculofacial plastic surgeon, here's what I would look for. Board certification in ophthalmology, that's the baseline. It tells you that they did that 4 years of training learning about the specialty of the eye. Then you want to look for fellowship training in oculoplastic or oculofacial or ophthalmic plastic surgery. That's the additional 2 years of training specifically on the eyelids and the areas around it. Membership in the American Society of Ophthalmic, Plastic, and Reconstructive Surgery, we call it ASOPers, is a very important milestone that you want to look for. It's a small society. It's pretty exclusive. It's hard to get into. You have to complete a recognized fellowship to get in. You have to do research and write a thesis. It's not an easy path, and you want the surgeon that has not taken the easy road. So in my opinion, that's what you're looking for. Now here's what I tell every patient who comes in for a second opinion to me. The system is not set up to make this easy on you. In most states, any licensed physician can legally perform eyelid surgery. The best specialties that do it are a comprehensive plastic surgeon like we've talked about, an ENT facial plastic surgeon, or as I've been talking about, an oculofacial plastic surgeons trained specifically in ophthalmology and then eyelid surgery. But you'll also see dermatologists offering it, even dentists. Some might do it well, but the medical system doesn't really sort surgeons by what they specialize in. It kind of sorts them by who has a good marketing budget and a good website. So patients end up doing the sorting themselves in a search bar at midnight after their lower eyelids just look a little bit puffy. That's not your fault, it's just the system. But now you know what most patients don't. Eyelid surgery itself is a subspecialty. It only makes sense to choose a surgeon who specializes in the area you're wanting to get treated, especially with an organ that's so important like the eye. Are you going to go get heart surgery from a general surgeon? Probably not. You're going to find a heart surgeon. Are you going to go get brain surgery from an orthopedic surgeon that fixes legs all the time? Probably not. You would find a neurosurgeon. The same logic applies here. Find someone whose entire career is focused on the eye and eyelid area, because even when it comes purely to the cosmetic approach, we have a really deep understanding of the eye and its surrounding anatomy, and that's the exact thing you'll want when you're making such an important decision. If you found this helpful, please hit subscribe. I make a video every week breaking down something about eyelid surgery that you can't easily find an answer to anywhere else. And I want to hear from you in the comments. If you're researching eyelid surgery right now, what's the question you can't get a straight answer on? Drop it below. Other people watching this video are probably searching for the same thing, and your question might actually help them. Thanks for watching, and I'll see you in the next video.